Imagine someone who cannot move anything below the neck reaching out and grasping a cup, not by someone else's hand, but through a robotic arm that responds to their thoughts. Picture a person composing an email, painting, or speaking, all powered by neural intent translated by artificial intelligence into action. This is not science fiction. This is today. Brain-computer interfaces, BCIs, are among the most consequential innovations of our era, bridging neuroscience, machine learning, and robotics to restore agency to people whose bodies no longer respond. The proof that changed the game. The leap from lab demo to real-world utility began with systems like BrainGate, which demonstrated that signals from the motor cortex can be decoded to control multi-degree of freedom robotic limbs. Early reports showed people with tetraplegia performing reach and grasp tasks, even serving themselves coffee, using neurally controlled arms. That work proved a crucial idea. The brain still speaks the language of movement even when the body can't listen. Since then, teams across the globe have iterated rapidly, improving reliability, latency, and day-to-day usability. The players, from labs to startups. Today, a diverse ecosystem drives progress. Academic groups at places like UCSF and Stanford, medical innovators developing surgical and minimally invasive implants, and well-funded startups such as Neuralink and Synchron, pushing both device density and deployment pathways. Synchron's stent road, implanted via blood vessels, illustrates a trend toward less invasive approaches, lowering surgical risk and accelerating recovery. Neuralink, with high-density arrays and wireless telemetry, showcases what extreme channel counts can enable. Both approaches highlight trade-offs: signal fidelity versus invasiveness, and long-term stability versus surgical complexity. How it works: sensors, decoders, robots. Sensors. Neural recordings come from three main families: penetrating microelectrode arrays, single neuron resolution; surface grids, local field potentials over cortex; and vascular stents with electrodes. Penetrating arrays capture rich spikes but face longevity and immune response challenges. Surface and vascular devices are less invasive but require more advanced decoding. Decoders. This is where AI earns its keep. Modern decoders use deep learning to build a personalized neural dictionary, mapping noisy, high-dimensional brain activity to intended movements, words, or commands. These models are adaptive. They learn with the user, compensate for neural drift, and improve accuracy across sessions. In trials, patients often show rapid gains because the decoder and the brain co-adapt. The AI learns the user, and the user learns to modulate their neural signals. Robots. Robotic arms today are not crude prosthetics. They have multiple degrees of freedom, force sensors, compliant actuation, and haptic feedback loops. Some systems feed sensory data back to the brain via stimulation, offering a primitive sense of touch. When decoding and control are tightly integrated, users can perform delicate tasks, hold an egg without crushing it, manipulate cutlery, or pick up a smartphone. Human stories, beyond headlines. Clinical trials and first-person reports illustrate profound impact. Participants paralyzed for years report performing self-care tasks, typing messages independently, and regaining a sense of dignity and autonomy. These gains are measurable: improved mood, reduced caregiver dependence, and higher social participation. The technology's value is not just functional, it's existential. Restoring control of daily life alters identity and agency in real, lasting ways. Where the field is accelerating: three converging trends. 1. Sensor density and miniaturization. Smaller, more numerous electrodes capture richer signals with less trauma. 2. Edge AI and latency reduction. On-device decoding reduces delay, enabling smoother, natural movement. 3. Wireless, untethered systems. Moving experiments out of the lab into the home makes daily use feasible and normalizes the technology. These trends are unlocking untethered, everyday applications. Users can don a wireless BCI and operate devices throughout the day without being constrained to a clinical environment. Beyond movement, speech, creativity, and multi-device control, BCIs are expanding past motor control. Speech neuroprostheses decode attempted or inner speech into text or synthetic audio, restoring near-natural conversational speed in early studies. Some systems can predict words before a user completes the thought, enabling remarkably fluid communication for people who have lost speech. Researchers are also teaching patients to control multiple devices simultaneously: a robotic arm, a cursor, and a virtual keyboard, all from the same neural stream. Artists are creating paintings through imagined visuals, composers are generating music by thought, and gamers are experimenting with brain-driven interfaces. The line between assistive medicine and cognitive augmentation is beginning to blur. The technical and ethical challenges. The breakthroughs are real, but the road is complex. Technical hurdles include implant longevity, immune response, signal drift, battery life, and cybersecurity. Penetrating electrodes may deliver great signals but can degrade. Vascular approaches are safer surgically but offer weaker signals. AI decoders must be robust to daily neural variability and avoid reinforcing biases. Ethical dilemmas are profound. Who owns neural data? How do we prevent misuse or coercion? How do we ensure equitable access to therapies that may cost hundreds of thousands today? Privacy guardrails for the thought layer are arguably more urgent than any data policy debate we've had so far. Regulatory and clinical pathways. Regulators face a delicate balancing act. Approve safe, effective devices quickly enough to save lives while ensuring long-term evidence of safety and benefit. Early approvals, breakthrough device designations, humanitarian device exemptions, can accelerate access, but long-term surveillance, tracking implant performance and adverse events is essential. Clinical endpoints now include not just safety and function, but quality of life metrics and caregiver burden reduction. The bigger picture: society, industry, and imagination. Industry investment is flooding in. Tech giants, venture funds, and governments see both humanitarian and commercial promise. The potential markets extend from medical devices to consumer augmentation, but that breadth raises social questions about who benefits and how. If BCIs advance to the point where anyone can control devices by thought, the ethical, economic, and legal frameworks will need to evolve fast. The commercial landscape. Who's building what? Several kinds of organizations are racing: deep tech startups, legacy medical device companies, academic spin-outs, and big tech. Neuralink aims to scale recording channels and wireless telemetry. Their approach bets on pushing the frontier of what neural signal resolution can do. Their narrative is rapid iteration and extreme engineering. Synchron took a less invasive path with the stent road, implanted via vascular access. Their value proposition is lower surgical risk, faster adoption, and broader clinical applicability for people unable or unwilling to undergo open neurosurgery. Academic consortia remain essential. They produce the careful clinical evidence about safety, outcomes, and long-term function that regulators require. Legacy medical device firms, think large neurostimulation companies, bring manufacturing scale, reimbursement relationships, and distribution channels that will be crucial for broad clinical rollout. Each player highlights a trade-off: speed versus safety, signal fidelity versus invasiveness, and cutting-edge research versus clinical scalability. Regulatory pathways and reimbursement. Device approval is not optional. BCIs that enter the human body must clear demanding safety and effectiveness thresholds. Regulators evaluate surgical risk, infection rates, device longevity, signal stability, cybersecurity, and quality of life outcomes. Many developers pursue breakthrough device designations or humanitarian exemptions to accelerate access for patients with few alternatives. That helps, but it doesn't circumvent the need for long-term post-market surveillance. Ethics and privacy. The new frontiers of personhood. Who owns neural data? Brain signals can reveal intent, emotion, and even inner speech in emerging systems. Legal frameworks for medical records, biometrics, and personal data provide some guidance, but neural data is different. It is the substrate of thought. Clear consent protocols, data minimization, and strong encryption are non-negotiable. Consent and capacity. Many BCI users have impaired communication. Ensuring informed consent, both for surgery and long-term data use, requires extra safeguards: independent advocates, repeated consent checks, and transparent decline/withdrawal procedures. If this exploration moved you, here's one small action. Share this video with someone who cares about technology and humanity: a friend, a caregiver, or a policymaker. If you want more deep dives on the frontiers of finance, tech, and human potential, subscribe to Tech AI Vision. We bring clarity to complex change, so you can decide how to live in it.